I've learned a lot today. I think we have had reassurance from many of the stakeholders that what we have been doing very well. We have also learned a lot of lessons, so the evidence generation is going well, and I think we need to continue that. We need to build preparedness in peacetime or out of the crisis times when you have a pandemic, so that really the evidence can be generated rapidly when it's needed. And we can scale up in time and get speedy without jeopardizing the quality. We learned that facts are needed, but they are not enough. So one of the main key messages from today that I take home is how can we communicate these more effectively, and how can we do these studies and communicate with those involved, and that is citizens and patients. So my head is really around how can we engage them better? How can we, all these thousands of tables that we have generated and delivered to regulators, how can we create appealing messages for those that need to make decisions about their own vaccination strategy and that may have comorbidities, that may be pregnant, that may have children? How can we give the evidence back to them in a meaningful manner?
Increasingly, providers, I don't know if you've spoken to a nurse or a doctor recently, but they often feel like they don't get the time they want with their patients. And in an effort to give that back, the healthcare system is utilizing every technology available to help improve patient outcomes by improving the quality of care that providers are able to provide to patients. As they use those technologies, we need to be able to follow that thread through to understand how the use of those technologies is impacting the data and therefore the conclusions we make from the data when we analyze it. People have to understand what you're doing with their work in order to care about it.
Transparency is key in building this trust. Which data is collected by whom? What is it used for? Is it in a safe place? Who's going to benefit from it in the end? Who is going to publish it? And is this coming to a public benefit in the end? And I think these kind of demonstrating these tangible benefits for patients and citizens in general is really important.